All right. Well, hey everybody. Happy Tuesday. Welcome back. I know it's been a little while since we've done this, so it's been a few weeks off. But hopefully everybody had a wonderful holiday and great Thanksgiving, and you're starting to enjoy the holiday season. It jumps up on you very quickly here. I don't know what happened. Years ago, it seemed to be slow, and now all of a sudden it's boom. So anyway, I'm sure you feel that same way. So I want to welcome you if you're a returner, right? And say thank you always for participating. Thank you for the feedback. I get a ton of feedback, and I feel great that you feel comfortable to give me that feedback, and then to try to make this as good of a conversation as we can. If you're new to the course and class, I want to take the opportunity to welcome you as well. My name is Dr. Roney. I host the Cancer Conversation. I am the clinic director and the Healing Center, and I also see patients. I help them through the process of understanding step by step what the orders were from the doctor, the priority list, what supplements are highest priority. So I try to walk them through step by step as much as I can to create clarity upon their initial visit here, because it's so overwhelming. And then I also see them throughout their process to help the same thing, create clarity, and then also to make sure that I'm working them through pillar 4, which is are the causes, right? Peeling back the layers of the onion as to what may have caused the condition in the first place. So that's my introduction. Tonight, we're going to have Dr. Connealy on, and I thought it was a really good idea to pop in here some case studies and kind of allow you to understand the thought process and the step-by-step, I guess, doctoring, if you will, where what tests did we order and why, what direction we went in, or Dr. Connealy felt that she needed to go in and why, because I think it's all relevant. I tell the story of a close family member of mine, and I've told this multiple times. So if I'm redundant, I apologize, but I think it really helps, where I went through with this family member. She had a lumpectomy, I'll back up. She had a small tumor that was discovered on workup, cystic breast for years. So they consistently wanted to do, MRIs and maybe every 6 to 8 months and so forth, some ultrasounds, thermography, things like that. And one thing changed from one MRI to the other. So it was like, we're not sure what to do about that. So we went further. We did some cryo, got it biopsied, and it was cancerous, right? So we then went to the oncologist and the surgeon. And my thought process is, and I think this is relevant, I want to hear from everybody, right? I want to hear all sides, and then I want to get informed, and then I want to do what makes the most sense. But some of the questions that were asked, I think, are very important, right? So in this specific case, they told us that if we did a lumpectomy, there was a high percentage chance that if they get everything, things are good. There's a very good survival rate out 5 years. Now, if you're familiar with this, 5 years is the amount of time they give you as far as survival rate. So it's just a point in time. Anyway, so the next question I asked is, because they wanted radiation as well. So, well, if you add radiation, what's the percentage of healing? And it went up significantly. So with a lumpectomy and radiation, it was a 95% survival rate over, say, that 5-year time frame. Well, that made a lot of sense. So the benefit outweighed the risk, right? That was what the conclusion that I helped her come to. And then with all the adjunctive therapies we did here, which I'll go over, your pillar 1 is going to be the lab testing. So we did the RGCC test, which helped us determine whether or not there were circulating tumor cells. And those circulating tumor cells are cells that cleave off the original tumor and are circulating in the bloodstream. Thank goodness for her, it was zero. There was no circulating tumor cell activity. So with that, she was able to find it early enough to where it didn't do, it didn't spread, it didn't do damage, it didn't have circulating tumor cell activity. So with that, we then got to work on immune boosting oxygenating the body, alkalizing the body, which I'll go over as far as some of our pillars. And then finally, we're working hard over this last year on the causes. We tested everything from heavy metals and non-metal toxins, and we did fungal testing like candida and mycotoxins. We looked at the oral cavity to make sure there was no mercury, there was no cavitations. We looked at hormone balance and cortisol, which is the stress hormones, and blood sugar and thyroid. We got into all of the nitty-gritty that was needed to make sure that we did our best job to clean up some of the causes as well. So with all of that, right, the lumpectomy, the radiation, and during the time of surgery, before surgery and after, and during the time of radiation, we also did things to help clear the side effects from radiation, and we helped the body heal from the surgery. Here's Dr. Connealy, by the way.
Hello, everyone. How are you? Thank you for participating with us tonight.
Yeah, so I was just giving them my personal history as far as the family member that went through the lumpectomy and radiation, and kind of walking them through, and to parlay into the case studies that we want to do. And the reason we do them is because we found when we share these case studies, it's very relatable. And it starts to allow the context of what we're talking about to be applied to a real person, which is, I feel like, going to help the audience significantly. Right? Is that fair?
Right.
Yeah. So I just shared my story, but Dr. Connealy's going to get into some of the case studies, some interesting case studies.
Right.
And then we'll certainly take questions for sure. So without further ado.
Yeah. I want to welcome everybody and thank you for participating and taking charge of your own health by getting educated, whether it's with us or the latest podcast or the latest Instagram. You can never stop learning. We are on a nonstop learning curve here each and every day. All of our doctors, all of our practitioners are constantly listening to our lecture, reading a book, talking to a specialist. I mean, it is nonstop because the patient in front of us is sick today and they're looking for answers. And I'll tell you a story about a patient that came in today. She's 61 years old. She's a brand new patient. She was referred by a friend, and she was diagnosed in 2011. And she had both of her breasts removed and chemotherapy and radiation, which is the typical standard of care. So it all came back in about 2018, stage 4. So they've been playing rotate the drugs. Let's try this drug. Let's try that drug. Let's try this. Let's try radiation on that bone. And I said, well, what have you done to change the environment and the terrain of every single cell in your body? I said, so because you're creating this perfect storm for cancer, but just taking a drug or an estrogen blocker is not going to change the storm that the cancer came in. And so I said, these doctors need to look at all the underlying features of every single patient. And so she's now in my office, stage 4, the scans. She's been on palliative therapy for 3 years now. So that means she's on pain medicine, and it's let's try this clinical trial and let's try clinical trial. And so I went over an extensive, review of how she lives every single day. And typically the oncologist will draw a blood test of a chemistry panel and a CBC, and that is it, nothing else. So we draw very, very extensive. If you read my book, I talk about all the blood testing that we do and why we do it. It's not just that we do it, but we have very specific reasons why we do every single thing that we do.
Right.
So she's like, well, right now she's like I want to know what I can do. And so I said, well, the first thing we need to do is we need to get you functional. Okay. You're not functional. The only thing she can do is walk around in her house. She's lost a lot of weight. And so I said, but you got to add energy to your body. So, and medicines take away. It's an electron stealer. Okay. Our body's a biochemical, biophysical, and bioenergetic being. So if we do not add energy so that every cell works, so our average cell needs 25 millivolts of energy to work. So cancer patients have an energy of somewhere between 0 and 15. So if you don't have 25, at least the cells can't take care of you. And so if you get injured, if I hit Dr. Roney's hand with a hammer and hurt him, he's going to have an injury. So he's going to need 50 volts to fix his injured hand. Okay. And so your body comes in and brings in energy. And then obviously there's external energy sources we can use to add energy to the body. So we do that with food, like, greens, we will do it, like juicing, we'll do that. All right. Walking barefoot on the beach will add energy to the body. Walking barefoot on any surface will. Your nutrition will. Love and hugging. That's why it's so important to have love in your life and hugging people. They give you electron donors. So if I hug Dr. Roney, I've given him positive energy. All right. That's why hugging is so important. And so anyway, first of all, she's lost a lot of weight. So I put her on a special powder to put on weight. She was using sugary drinks of Ensure or one of those kind of things. And then I told her the energy things that we're going to do to add. So we do a device called Cellsonic. So that puts energy into the body. We do something called pulsed electromagnetic fields. Then I told her we're going to do an IV alkaline drip because patients who are that in stage 4, they're very acidic. Because why? What happens is you have a pH. Your pH is supposed to be about 7.4. And stress and bugs and chemicals and toxins and heavy metals all bring the pH down. And when the pH goes down, the energy of the cell, the voltage goes down, and then the oxygen levels go down. And when you have oxygen levels go down, then you have an environment for cancer. So I put her on mistletoe, IV mistletoe. I put her on, I'm having her do lymphatic drainage. She said her job, she doesn't have any children. She's been married to the same man who was at the visit for 40 years. And she said she had extreme stress from her job. She was like, ball and chain with her job. So slowly, but slowly. And I said, we're going to take one day at a time. But the key thing is to get you functional. And she had some lesions on her. When I did her physical exam, she had a lesion on her back of her neck where I'm pressing where Dr. Roney is. And then she had some lesions and she said she was going to go get radiation. I said, no, I don't want you to do that. I want you to go to this special place that does hyperthermia, which is elevating the body part to a certain temperature with low dose radiation. Mm-hmm. So anyway, so that's a typical first visit. And the husband said, he goes, in 30 years, I've never had a doctor talk to me about all of these things you're talking to me about. Mm-hmm. And I said, well, that's ridiculous because every doctor should be doing all of this because this information is everywhere. Mm-hmm. And so, and that's why we do these classes, because we want you to know that there are other ways of taking care of yourself. I didn't tell her to stop taking her medicines right now. I didn't do that because that's maybe what she maybe needs. And I always tell patients, medications or surgery or conventional medical interventions may be a bridge to get to the other side because cancer is a spectrum. It's a whole timeline. And so your goal is to get to NED, no evidence of disease on a CT or PET scan. And then after that, as you guys know from these conversations, is that just because a scan says NED, no evidence of disease, doesn't mean that there's nothing there, right? it means that there's nothing big enough, because a scan will show 5 millimeters and above. And then a scan doesn't tell me the functional aspect of you, your nutritional status, your blood status, all the other things, the bioenergetic status of you. So we have to, keep that continuum to your stage 0, which is our version of getting a patient completely healthy. And then what I find is the patients think they're fine for 5 years. Oh, I've been fine for 5 years. I've been fine for 10 years. I'm fine. Well, no, we have to verify you're fine. You have to make sure that you're fine all the time. Okay. There's no finish line to being healthy or to maintaining health. It's a constant continuum. And that's not a good or bad thing.
Mm-hmm.
That is just reality. Just like you've got to make sure that you have enough money in your bank account. And so you got to check that on a regular basis, because you're using it like you're using your body all the time. So you got to make sure you got enough funds in your system to take care of you. So anyway, so I want to go over another case. Is there any slides on this?
Yes.
Okay.
Yep.
So I had a darling woman come to see me from Idaho. And so ovarian cancer. Okay. And she came to see me several years ago. And she had been, hold on, let me get my thing. So here she is. She's a 43-year-old female, works as a life coach, married, just had a baby, and she was walking up the stairs with some shortness of breath, which didn't alarm her too much on her neck area. She felt something. So she visited her dermatologist on a routine appointment, and her doctor said, you better get some tests run. So she went to the local clinic, and they referred her to the hospital, who ran a number of tests. And subsequently, she had a biopsy, and they performed a complete evaluation and did a biopsy of that lymph node. And they determined that it was metastatic ovarian cancer. So she also had the cancer not only there, but all over all of her peritoneum, which is the blanket of the abdomen. And so anyway, she had, stage 4. Okay. So she had to have an emergency total hysterectomy and debulking of the cancer. And the doctor said, there were sprinkles of tumors all over her peritoneum. So anyway, her family went and started researching everything and decided, okay, what are we going to do? And so she felt that the doctors, all they were doing is instilling fear. And she said, I don't want to proceed with conventional treatment. So she had watched many podcasts, and she learned about us. And so after watching many documentaries, she started implementing coffee enemas. And then her first visit with us was on telehealth. Then she came to the center, and her, this goes back, I don't know. Okay. So anyway, I'll read that because it's not okay. Yep. So when we ordered comprehensive blood testing, and her tumor marker, her CA-125, which is the typical tumor marker for ovarian cancer, was 910. And just to doing her own self-care and the few things that we told her to do, her tumor marker went from 910 to 640 without treatment yet from us. The normal range is 0 to 35. So when she came here, we did comprehensive blood testing. That's looking at everything from blood sugar to vitamin D to thyroid to hormones to levels of acidity called LDH. We did a D-dimer that tells me if patients have a predisposition to clot or the cancer is on the move. And so anyway, she did all that. Then we did the RGCC, which is the test from Greece that looks at comprehensive circulating tumor cells, natural and chemo agents that might work. She did bioenergetic testing to look at some of the underlying causes. We did a nagalase testing. We did the PHI, which tells me if the patient is in low oxygen. And we did the NutriVal test, which checks her nutrients. And then we told her to read read the Cancer Revolution. And then I had given her many handouts on all the things possibly we might do on her. So that was EVOX, emotional work. I encourage every single patient to do emotional work on themselves, because there's a great book called Your Body Keeps Score and The Emotion Code. And those two things, because emotions are stored as electromagnetic frequencies in your body. So we all have something to work on, everybody, because this starts from in utero. And so you don't know what happened at 1-year-old, 2-year-old, or 5-year-old. So we all need to do something to do an emotional attunement, I call it. So then I gave her vitamin C. I gave her pancreatic enzymes. I gave her carbon-60 and something for her immune system. I told her continue to do coffee enemas at home. And then I told her to watch the show by Doug Kaufman called Know the Cause, because he's kind of an expert, he's an expert on fungus, and fungus is closely related to cancer. In fact, 85% of cancer patients have fungus. And so and a lot of people think the fungus kind of comes and creates this abnormal acidic chemical kind of environment that, the fungus is eating off. It's a saprophytic. So, all fungus are part of nature. And so what they do when a leaf falls off the ground, they all have fungal spores because it makes that leaf decay and take care of itself. Mm-hmm. So anyway, then I gave her Epsom salts to do baths with Epsom salts, baking soda, and clay. So she started all that. And then when we got the RGCC back, I gave her the rotation of supplements to start killing the circulating tumor cell. Some of the examples of that were Oncobel, coenzyme Q10, curcumin, cordyceps, endo-3 carbinol, artemisinin. All those things are known anti-cancer substances. Mm-hmm. Then she set up a consult to go over fractionated chemo. And she met with Dr. Roney to go over her results. And then Dr. Roney gave her specific things that were reflected in her NutriVal. And this is a example of a NutriVal, because because your body's a biochemical machine. So it tells us what nutrients, which are the biochemicals that make your body work. It's something called the Krebs cycle of energy. And your Krebs cycle of energy is you have to have all these nutrients for this to work for you, because that's how you make ATP. And ATP is energy. So, for example, if you have a deficiency in B vitamins, the citric acid cycle is not going to work. Mm-hmm. Okay. And if you have heavy metals that are interfering with this spot and this spot, well, you have breakdown of the whole system. So that's why we always check for chemicals and toxicity. So we told her to sign up for our cancer conversation. And back then we called them cancer classes. And then we started IV vitamin C and mistletoe. We started hyperbaric oxygen. We started celsonic treatment. We started pulsed electromagnetic field to charge the cell. We started lymphatic drainage, infrared sauna, EVOX, exercise, daily affirmations, and prayer. So I will tell you something, that when I examined her and I could feel the tumors in her legs and in her buttocks, it wasn't obviously just in her abdomen. So a PET scan doesn't go down below right above your hips. And so anyway, so she had very, very serious stage 4, cancer everywhere. So anyway, she continued. She stayed here for a couple of months and did low fractionated chemo once a week. And she took her supplement protocol. And she had a repeat PET scan, and in her initial PET scan, it says abnormal accumulation in her right and left nodes, liver lesions, spleen enlarged with multiple lesions in the pelvis, right thigh, buttocks, everything. So, but it's interesting. Remember, her CA-125 that's not it, because that's a prostate. It was 900 and something. Before we started, it was 208 just doing her self-care. Okay. So anyway, she had a circulating tumor cells of 5.9. And then after review of her PET scan, we say, okay, now we can start the fractionated chemo, because we always order a PET scan so we can see our landscape of where we're starting. Okay. So she continues to do all of her treatments here, and, all the vitamin C, we put her on endo laser to activate the entire protocol. And so she does 8 treatments. And so her PET scan, that was done a couple months later. So it says here, there is still accumulation in the lymph nodes, but it says improved when compared to the prior exam. Her right lung effusion had decreased in size, and all of the lymph nodes have decreased in size and intensity. And the previous lesion on the liver shrunk from 2.1 to 1.6. The lesions on the spleen had decreased, and the calcifications on her thigh had also decreased. So at that time, her CA-125 was 84, so down from 900 and something when we started. And she continues rotation of her circulating tumor cells. She continues to do low-dose chemo. She'd fly in every couple of weeks because she has a baby. So she went home and would fly in every couple of weeks. And her home plan was stay on her supplements of her circulating tumor cell, do her baths, guided imagery, healing affirmations and prayer, coffee enema, Bravo suppository, and grass-fed liver daily. And so her CA-125 now went down. She was continuing low-dose chemo just once a month, and she's down to 25 now, from 900 and something to 25. And she's still doing her home treatments. And when she does the fractionated chemo, we do IV vitamin C. We do a special IV to repair the liver. And we gave her hydrogen peroxide AV that helps get rid of chronic infections. We gave her endo laser to kill off different viruses and assist the chemo in attacking. And then we had her LED bed also. LED is basically red lights that fuel the mitochondria, which are your powerhouse engines of your cell that make energy. So anyway, she continues to do well on all these treatments, and she continued, like I said, the low-dose chemo, and now she's well and alive, doing great and wonderful. She's on her home treatment plan, in Idaho, and doing lots of, she did a lot of emotional work, a lot of mental work, lots of everything. But this is like worst case scenario of a patient, guys, who is, completely on the other side. And I always tell people all these things take time, but, and she didn't really, when she was here, it's not like she was suffering. Mm. She actually survived and thrived. And she looked great. And she looked great and did very, very well. So that's an example of an ovarian. I'm not saying we will intermix these treatments, very similarly with other patients. Obviously, everybody's different. They're going to need different things, different work, and different interventions. But I'll tell you about like a prostate cancer. We talk a lot about breast, and we talk a lot about some of the female cancer. So it's good to talk about guys with prostate cancer, since that's one of the top cancers. So prostate cancer is relatively, if you're going to get a cancer, prostate is probably the best. Okay. Probably the easiest to treat. And the treatments are get a prostatectomy. Usually they do it robotically now. Radiation, radioactive seeds, high intensity frequency ultrasound, and androgen deprivation therapy. So it shows, though, that very little evidence that these treatments really improve the survival for patients. So now most of the urologists today, the latest study shows that watchful waiting or active surveillance. So watchful waiting in the conventional world is, we'll just check you and see how you're doing, but they don't really do anything except check a PSA, and that's it. So anyway, watchful waiting, we are proactive surveillance. So we say, no, we're going to turn this around right now. So the first thing that I will do is I do comprehensive blood work. But when a patient with prostate cancer, we need to look at everything. We need to look at their estrogen level, their progesterone levels, their testosterone levels. We do a blood test called PAP, prostatic acid phosphatase, because that tells us if it broke open on the capsule. We do dihydrotestosterone, which is an unfavorable testosterone for the prostate. And we will do special tests to see if it's an aggressive form of the prostate. And then I always order an MRI of the prostate. So the MRI will tell us okay, what does it look like? So, and we do a very similar workup on every single patient. We want to know how a patient lives every single day. How do they conduct their life? How do they sleep? Are they drinking enough purified water? Are they eating the foods that are going to nourish, strengthen, and heal their bodies? What is their activity of movement? If you don't do activity and movement, you can't create energy in the cell. You have battery packs on the side of your muscles, and those hold energy. And the more you move, the more that you activate the energy voltage in those cells. So that's why exercise is vital to every single person, because you have 800 muscles that are holding the energy. And the more you move, the more you activate those. And then we want to know about teeth. Root canals, there's probably a very strong correlation between root canals and cancer, because root canal is a chronic infection. If it's not properly removed, then the patient has a brewing infection, and that will bring your immune system down about 60% and take out the energy of the body also. So because anything that you do, you've got to make sure that there's a counter move, just like Dr. Barney was saying when I walked in. So if you're going to do a PET scan, you better do all this protective before, during, and after, because that is radiation and it's carcinogenic and cancer causing. So we want to protect our patients all the way along. So then I want to know what happened in the last 10 years, because we know cancer is about a 10-year guideline. So from one cancer cell to tumor is 10 years. And so what's happened in your life? So usually patients will recount to me, I would say 100% of the time, what has happened to them in the last 10 years. And so it's many things to people, and it may be losing parents. It's all different things. So stress is just as important to address as someone's, blood work. Okay. And so, and then we always do a complete physical exam with the patients. And in fact, with the patient that came in today, I was telling them everything I found, and they're like, well, you're like the first doctor in 30 years that has told us this stuff. And I'm like, well, if you don't look, you can't find. And so anyway, and I took pictures of her lesions to document for the chart so we can show her how it's going to improve. And so anyway, we got to make sure that we are looking at everything from head to toe, your hair, your ears, your lymph system, your heart, liver, bones, et cetera, et cetera, et cetera. So anyway, then we order all this blood test. And in the meantime, we usually have the patient do something. Sometimes we have the patient do a cleanse. If they're very thin, we don't have them do a cleanse. Because anybody with weight loss, I don't want them doing a cleansing because I don't want them to lose any weight. And typically, you'll lose weight on a cleanse. Sometimes we tell our patients to fast. So we have all different programs because every individual is an original, and what you need and the next person need are probably two different things. So we individually assess what each patient needs. And then we may put them on supplements. If they don't go on a cleanse, we will put them on targeted supplements. Like the top things we like to do is vitamin C, because we know that helps the immune system. It's the antidote for chemicals, toxicity, and bugs. So that's a great thing. Linus Pauling did all the work and paved the road for us a long, long time ago about all the power of vitamin C. And then we give pancreatic enzymes because cancer coats itself in fibrin. And so if you look at how when a mother gets pregnant, right, and what does she make? She makes a placenta. And the placenta is a foreign body, and it's a collection of intense blood vessels, right? And so the body doesn't go, oh, you're not supposed to be here. No, because what happens is at 6 weeks, the fetus starts making pancreatic enzymes. And with the help of the person, the mother, they both make a little pancreatic enzymes. And so they don't reject that pancreas. I mean, that placenta. So it's a beautiful thing in nature. So very much. So cancer is like a placenta. And so that's why you do the pancreatic enzymes. Now, this started over 100 years ago with Professor John Beard. You can go read his stuff. I read Professor John Beard, Professor Kelly, and Dr. William Kelly, who wrote the book, One Answer to Cancer. And then the next guy, the doctor in New York that died, the immunologist. Wonderful guy. Anyway, so all of those people have talked about it. And I read all the studies that they did. They did lots of studies on all these patient charts. And then because as I mentioned before, cancer is an acidic situation, because what makes you acidic? Stress, nutritional deficiencies, toxicity, and different bugs and heavy metals. All of those cause acidity. And then nothing happens overnight. It happens over time. So then we give the patient some, we use either baking soda or pH adjust. The pH adjust is more palatable for the patients. So we do that. And then we usually give them carbon 60. Carbon 60 is this fullerene substance. It's really basically charcoal. And it is in a special formula. It looks like a soccer ball. And the soccer ball basically attracts those toxins and pulls them out. And this helps get toxins out of the small little crevices of your mitochondria. And it's anti-cancer and anti a lot of things. So it has a lot of beautiful properties. And it's immersed and prepared in olive oil. So that's how we'll start the patient. Then we give a lot of patients the reading materials. We encourage them to do cancer conversation, read my book, because you've got to study anything you want to be an expert on. And there isn't anything better to be an expert than on your own body. Okay. You have 50 to 100 trillion cells, and learning the 50, 100 trillion cells is going to take time and diligence and effort and execution. So don't think it's just going to happen overnight. It's going to take time. Give yourself a year of immersing yourself in tremendous amount of reading and education and podcast and anything you want to fill your mind with. And you got to have your mind full of, lovely, beautiful thoughts all the time.
Got to do it all.
You got to do it all. So anyway, this is a gentleman who had lower abdominal pain, was sent for an MRI, and he had an enlarged prostate. Now, he underwent a conventional prostatectomy. Now, I would say rarely do we see that very frequently. And because usually the patients are conservative and what they are going to, they want to, keep their organs. Mm-hmm. So anyway.
There's some sensitive nerves down there.
Yeah, exactly. And then what are the side effects? The side effects obviously are going to be, functionality in many areas, whether it's urination or having intimacy or, anything down there is going to very possibly be changed. At least almost every person I've seen, they have permanent, long-term effects. Mm-hmm. So anyway, he showed 1 out of 6 lymph nodes. So that means there's something still going on. So we gave him, you typically will use something called androgen blockade, which is blocking the testosterone level. And he didn't want to do that. And so he started taking the oral pill, but he didn't want to do the radiation in Lupron because Lupron is much more dramatic than Casodex, or the generic name is biclutamide. And so he had a history of hernia, which, in other doctors in the past, I've learned that is something to be looking out for as far as a sign for cancer, because you're when you have a hernia, you're stealing big and destroying big groups of muscle. So why is your body in a catabolic state? You're supposed to be in an anabolic building state, not in a breakdown state. So his physical exam was unremarkable. So you can see all the different treatments we did. We did SOT, which is taking the circulating tumor cells, reverse engineering a new messenger RNA to disrupt the DNA of the cancer cell. He did bioenergetic testing with Molly. We've done prior conversation on that, correct, Dr. Brony? Sure. A nutrition, EVOX, hyperbaric, nanobath. He did IV vitamin C. He did whole body ozone, infrared sauna, castor oil pack, rectal ozone. He bought his own Photon Genius because we don't do that here, but he bought it from his home. And then here's his supplements he was on. And so he had received a total of 3 SOT treatments. And then he had some new activity. This was a couple of years later on his lymph nodes and his right iliac bone. And so he was considering going to Mexico or Germany for additional treatment. You want to see the next page. So here is another guy, 62-year-old male with diagnosis of prostate cancer. And he was diagnosed with prostate cancer. And he did not do any surgery, radiation, chemo. And then he had a hernia. He had root canals. And he did bioenergetic testing. We did a 21-day purification program, meditation. Then he did other supplements. You could see there Methyl Protect, turmeric, which is curcumin, cinnamon, so forth. And he follows up regularly, doing great, and following up regularly for just a preventive, proactive approach. So you can see, that every individual is an original. There's no two people alike. And the key thing is prevention and early detection, I would say, especially because what we're seeing in the last year is an enormous increase in cancer, especially in young people. And I always say young people are the canaries in the mine for what's going on in the world, just like children are. But when patients, for me, if they're 30, they're like my children too, because they're young. And when you have cancer and you're young, it's a much more aggressive situation. So we want to, educate and empower people to try to, know what's going on, get a complete evaluation, not just on a physical level or on a, physical exam, but blood level, but you got to know the blood work to do because you have to do comprehensive blood testing. And then you need to do some evaluation of your mouth and teeth. Okay. You've got to do an evaluation of everything, removing all the thorns that could possibly be going on. Like we see patients that have mold and we'll be seeing the patient and then all of a sudden after 5 years they're worse. And then we've come to find out, oh, they're living in a moldy house. Mm-hmm. And you're like, okay. And they didn't even know it until,
guide them in that direction.
Yeah, because they started feeling bad. And here they were 5 years out, great, or 10 years out. And then all of a sudden they're not doing so good. So it's not the kind of thing you check once and, okay, I checked that box. It's the kind of thing that you partner with a functional integrative doctor only because they're looking at the body as a complex biological system. Mm-hmm. And then they're like, okay, slowly, methodically, and analytically fixing everything. Mm-hmm. And so pretty soon we're going to be checking, we'll be implementing this very, very soon. We're going to be checking the voltage of every single patient that comes in here. And I talked about this earlier about that every cell has to have the proper energy voltage. So we've taken the courses and reading the books, and now we're going to be implementing that and making sure people are properly charged. So
if they can properly heal.
Yeah, exactly. Yeah, because if they don't have the energy, they can't heal. So anyway, we want to open it up for questions.
Yeah, let's do some questions and then we'll, I'll go here. Vitamin C, membrane-associated catalase, which protects cancer cells and thus renders vitamin C ineffective. So membrane-associated catalase, right?
Mm-hmm, right.
Yeah.
Exactly.
Yeah. So do we account for that as what they're...
Exactly. Yeah, because you're right. You can't just rely on just that they have the IV vitamin C and it's making hydrogen peroxide. You're absolutely right. So absolutely.
Yeah.
Correct.
Yep. One thing that I'll add, ladies and gentlemen, is as far as Dr. Connealy's, her points, right? There's some of the cases that we've talked about in the past, Aaron, and then you just highlighted one today. What works, what the eyeballs tell us is the this, that, and the other thing. Would you agree? Meaning you have to look at everything. We have to look at the right testing. They have to figure out how to kill the cancer cells, or you all do. And then we have to boost the immune system. You have to oxygenate. You have to alkalize. You have to go through the causes and peel back the layers of the onion, the hurricane, tsunami, and tornado, right? And then if you're doing all those things in accordance with some type of plan like that, you're going to have the best chance to heal. And that's what we see. That's what the eyeballs tell us every day. I was on, just real quick, I was on with a patient, stage 4 prostate, metastatic. He's in another state working, and he's been on a project for a month and a half, 2 months. And he's doing vitamin C there. He's doing hyperbaric. He's doing supplements, but it's hit or miss.
Right.
And he said, do you think all this is helping? And I said, well, it's not hurting,
right,
but it's very incomplete based on the diagnosis. I said, once you get done that project, you're going to have to come out here
and
regroup and reset. And that's only because of the diagnosis. So it's what's presented to us that we then have to go, whoa, based on our experience, we then have to say, look, you're going to need something more aggressive. So I set them up with a fractionated chemo consult. They're going to need something like that, whether it's conventional or fractionated or low dose
something
here.
Like that.
They're going to have to do a full complement, or he's going to have to do a full complement of what we just talked about as far as a plan to give himself the best chance. So his big thing was, do you think any of this is helping? I said, well, it's not hurting, but it's far from complete to get you to where you need to get to your point, the other side.
Right.
It's a lot of things that are needed.
And you must do like every single thing.
Yeah.
You can't, it's one thing you have a little cut, but when you have the very mysterious occult process of cancer, you do everything.
Yeah.
Okay.
Yeah.
There isn't anything you don't do. Okay. Even on the early stage cancers, I feel like, okay, we got to make sure that we are have every little arrow in the quiver, and we're using it all. It's easy to relax once you fix everything, but let's not take a kickback, relax approach with any patient with cancer.
Right.
So a patient asks, which products do you use for those who need to gain weight? So our product, it's not our product, but it's a product that I've used for over 20 years. It's called Genesis Rice Bran. You can call the store and order it, mix it with some coconut milk. And I don't know how much weight you need to gain, but I usually put patients on 4 scoops 1 to 3 times a day, depending upon how much weight they've lost.
Right.
And then the patient asked about the membrane-associated catalase. So we have to make sure that the vitamin C is, one, at a therapeutic level, number one. Number two, vitamin C doesn't do everything. So you can't just rely on vitamin C for its cancer-killing effect. You may have to use IV artesunate, IV resveratrol, IV curcumin, a whole different other. So we don't just rely on IV vitamin C. That's not the only thing in our menu. Do we take insurance? No, we don't. We don't take insurance for the care that we give here. We do treat patients via telehealth, but I will tell anybody that you can't treat cancer over the phone or over Zoom. So
that's here or anywhere else.
Yeah. I don't know any doctor who can do that. So yes, you can use experts for different things. Like I have patients do consults with patients and do consults, see what they have to say. So, and now someone chimed in if HPV is detected. So HPV is human papillomavirus, which is a virus that's connected to 50% of head and neck cancers and lots of female cancers and other cancers. There's lots of viruses, Epstein-Barr, cytomegalovirus. These can all be related to cancer. Why? Because any kind of virus is a chronic inflammatory. So viruses never go away. They're either asleep or awake. If they're awake, they're causing a drag to the immune system and inflammation. So we always address, again, a viral component.
Mm-hmm.
Says, do we need to make an appointment to see if we are properly charged? What is that? Oh, yeah, you'll definitely need to make an appointment. You have to do that in person. So
she's coming next week. Are we set up for that yet?
I know it's supposed to happen this week. Yeah. So I will verify. Write down Sophia's name.
Yep.
Can you write down Sophia Van Brunt?
Yep. Got
it. And we will do that on you. Yep. Okay.
Telemedicine consult prior to an appointment.
Yeah, of course we do. Of course we will do that.
Yeah.
Okay. So since COVID, lots of rules have changed. So we got to follow the rules and do it. We'll do a telemedicine, and then we can implement whatever we want when you come here.
Yeah.
So
it's one thing with the telemedicine, we can at least go over the history and kind of get an idea of what's what, and almost guide you a little bit, but not give you direct treatment or direct, labs and things like that.
Prescriptions.
Yeah, exactly. So Ms. Stephanie, how would a person know how long they have to come to the center to do initial testing?
Well, if you don't have anything wrong, I would just put aside a couple of days.
Mm-hmm.
Now, if you already have a diagnosis of cancer, then I won't know unless I knew your case to tell you. So if you're stage 0 or you stage 1, 2, so I need a little bit more detail to tell you, how many days. So like a patient today, she flew in from Montana.
Mm-hmm.
And she had pancreatic cancer, and she had already done conventional chemo with her doctors in Montana. And she had been done with chemo about 6 weeks ago. And her tumor markers were now normal. And that was the CA19-9, which is the marker for pancreatic cancer. And her scans look great. And so they said, oh, we want to do Whipple now. And she's like, what? You want to do Whipple, which is go look up Whipple procedure for pancreas. Yeah, anyone would think 3 times before they do that. Sometimes it's necessary, though. Don't get me wrong, guys.
Sure.
So anyway, I said, well, I reviewed your scan. You're 75. Let's just see what you can do. with what we're going to do. Okay. She's completely functional. She's not, weak. She's doing pretty good. So I said, let's just see what we can do. So that was just a brand new patient today. So she's here for 24 hours. She says, I'm going to come back. We exposed her to everything to know what we can do. I did give her an IV and I did do a few little things. And I said, figure out, go home, because her daughter came with her. And I said, you guys go figure it out when you can come, but you're going to she doesn't need more chemo, but she needs some supportive treatment so we can get her on the right track. So we can give her a home care plan.
Not sure what a lower D dimer besides nattokinase.
Yeah, what we lower D dimer is with Nepronol. So that works great. So that's a beautiful treatment for lowering D dimer. So
okay, all right. Polygraph fatigue and breast cancer treatments. I'm now off Ibrance and letrozole. Fibromyalgia and chronic fatigue is another substitute for an aromatase inhibitor. Good question.
Right. So you're off the medicines. Letrozole is a hormone blocker. Ibrance is a special medication that kind of interferes with the cancer. The cancer growth cycle. Okay. So both of those can cause chronic fatigue. They can also lower your white count. They can also lower your red blood cells, shutting down all your estrogen. You're going to have, sometimes bone pain, sometimes you're achy, sometimes you have dry skin, dry hair because, you're shutting down all the estrogen. So what we use is another form of aromatase inhibitor is I use myomin. That's a natural herb that lowers the estrogen level. And I use sometimes a sulforain product, which is an isolate from broccoli. And then obviously something's not right because you have chronic fatigue and fibromyalgia. So that means, you need to look at, every single thing going on in your system to restore the energy, the voltage, the vitality of your system.
32-year-old metastatic breast cancer patient, stage 3A. Tough one. One thing. Okay. First of all, you're 32, so there's no way one thing will work. And don't look at the 50 to 100 trillion cell miracle that you get the privilege of living in every single day as one thing. That would be like saying, what's the one thing you do to raise a child? Well, we know I'm a parent, Dr. Roney's a parent. There's over 1,000 things we do, and every one of them is important. So on a 32-year-old, you have to watch them like a hawk. Any young person, you must watch them very carefully because cancer is a very, very aggressive when you are 32 years of age. So first of all, we don't want to think limitedly. We want to think limitlessly. And so we would have you do many, many things to get your body back in homeostasis. I think right there, it's one where you'd have to figure out, okay, if it's aggressive, right? Use that term. Do you do conventional treatments, right? If you had to do,
you'd have to do it all.
Yeah, you'd have to do it all. If you did that, or you had to go that route, then you do these adjuncts where you do the IVs, you do the oxygen therapies, you do the, alkaline therapies, you get your metabolic system stronger and healthier and start working on the causes. But really the pillar, we call it pillar 2, how to kill those cells, is probably the most important in that, right? Deciding on what that looks like, whether it's you're going to go in the natural approach or you're going to go conventional, or you're going to do fractionated chemo. Whatever that looks like, that's probably the top priority. And then all these other things are fill-ins to be able to get your body to tolerate all that and to thrive. And of course, fix the causes. So.
Right. Because anything you do, any medicine, there is a downside for every single medicine you take. And we use medicines because we use repurposed drugs in our practice. We use lots of things. We talk about Erin. You guys have been on the cancer conversation before. She's on, probably 12 different medicines. But we have to do that. She has a very special case, and we can't leave one stone that's not covered.
But she's doing all these adjunct things to keep her body strong and healthy as well. It's kind of like this, gang. It's, if you're looking at a 20 chapter book, this, say it's conventional, whatever, that's one chapter of the 20 chapter book. There's 19 other chapters that we need that. And Dr. Connealy said this earlier, in this day and age, to where it's not a norm, where all these adjuncts are not a norm in the cancer care, is pretty perplexing, is it not?
Right.
With all the knowledge out there, it's beyond perplexing.
Beyond.
I always go down this road. I say it's no different than how we handled the pandemic, right? If you look at it, it's no different. It's very similar. They went this direction when there's so many other chapters that they could have been educating the masses on to save a lot of lives and to help a lot of people. Cancer, I don't think, is much different. They're looking at this when there's this available. Anyway, that's my soapbox. All right, here we go. So who in your office is best to check moles for melanoma?
Brandy.
Probably Brandy. Yeah.
Brandy Moreno. She's the skin.
She's very good.
Very good.
Oh, methylene blue with red light.
Yes, we do. Yes, we use that on patients. Yes.
Great technique for our modality. Have you had success with treating pancreatic cancer?
Yes, if you come early. That's the key thing. Most of the time, pancreatic cancer is detected very late. Mm-hmm. Like the lady that came in today, she'd already had chemotherapy and very successfully, and now we just got to figure out the rest of the things. So,
yeah. Vitamin C is ascorbic acid. Vitamin C changes pH of the body to more acidic state while being a great antioxidant.
Yeah, vitamin C is alkaline in your body. Yes, it is a good and great antioxidant, but it's great it's great substance to alkalinize the body too. Like lemons, you think they're acidic, but they convert to alkalinity in the body.
So Karen, do you know if carnivore can really work for cancer?
Well, I don't know any of the carnivore doctors that there's a lot of MDs that are carnivore. And, all of them don't just do carnivore. They just don't eat meat. They do other things. They eat fruit and they eat cheeses and they eat, different other things. So I know that certain patients eat carnivore only, and that's what they feel great. But again, I don't want anyone to say, oh, there's not just one way of eating for cancer or for one patient. So anyway, I wouldn't, that's just I wouldn't get stuck on any one eating plan.
We love eating real food.
And so you got to go to ancestral, go look at Weston Price, ancestral nutrition, the way cavemen have been eating for thousands of years.
Tom, the repeat of the weight gain, the Genesis, right?
Yeah, the Genesis rice bran. Mm-hmm.
All right.
We use the pre-Nevo scan, yes, all the time. Mm-hmm.
So there's a concern scheduled to see you all in the new year.
Right. Okay, great. We'll see you soon.
We'll look out for you for sure, Danielle. What type of testing would you do for sarcoma, since they do not have circulating tumor cells that can be detected?
Yeah, well, sarcoma usually is just surgical removal. Doctors will try chemo and radiation. The chemo, I haven't seen that to be successful. I'm not saying it'll never be successful. I'm just saying I don't see it successful. Sarcomas do have circulating tumor cells. Yes, they do. So, but you got to make sure you don't develop more sarcoma, which is a tumor of the muscle and bone. And so I would not use, sometimes they just use radiation alone. I would use a combination of hyperthermia with radiation. Again, I don't know your particular case and if you have tumors already and all that other kind of stuff. So I need, but testing, everyone needs super comprehensive testing, like I talk about in my book.
Yeah. RGCC, do all oncologists use it?
No, they don't.
Yeah.
Not yet, but there are new testing coming out all the time. I get a new solicitation on new labs all over the world. I met with Guardian 360 today at lunchtime to go over cases, which they pick out special mutations and what drugs might work and what immunotherapy might work. So I went over a lot of cases with them today. So again, there's all kinds of new testing coming out all the time.
They keep an eye on the clinical trials too, right?
Right. Exactly.
Yeah. So a lot of good testing that's coming out, or it's there now that we're using, that we can kind of dot all the I's and cross the T's as best we can. Medical mushrooms, turkey tail, reishi.
Yeah,
for sure.
They all have benefit. Yes.
Do the therapies work on all types of cancers? I have sarcoma.
Yes. Yes. Your body has a functionality index, and we evaluate all of that, and then we decide what each patient needs.
No,
and I don't know if you have a mass right now. So I don't know if you have like an existing mass right now. So I'd need to know. There's the conventional treatment is do surgery. You may need chemo. You may need radiation, and you have to do that alongside all the other supportive and targeted therapies that we may recommend. Okay, so
Susan here had a history back in 2014 on some supplements, letrozole. Not sure how her body's doing. Doesn't sleep well. Elevates blood sugar. Weight 98 pounds. Vegetarian diet, fish. Job eliminated now. It's 66 on Medicare. Oncologist just checks certain things. Don't want reoccurrence. So that's kind of the whole thing that we're talking about as far as doing the right testing, whether it's circulating tumor cell again, right? I'll let you answer that.
Yeah, exactly. So you need to, again, just because you had cancer back in 2014, you still do I know oncologists just do a chemistry and a CBC. We do much more intense testing on a regular basis because we found that that's the best way to follow a patient. And so you need all the comprehensive blood testing I'm talking about still. And then, yes, we would do RGCC, looking for the circulating tumor cells, since that's responsible for 95% of metastasis. So,
causes too, right? Definitely dive into that metabolic terrain.
Yes.
And see what's going on. Heavy metals, infections, non-metal toxins, fungal infections. I mean, your viral infections, all that can potentially matter as to fueling that fire. So those are important ones as well. Voltage in the body.
Yeah. So we'll be using little detectors on all your acupuncture meridians, checking the energy voltage coming out of the body. And then it will be able to tell us where you're low, where you're fine.
Okay, so
if you want to read a great book, there's a great book called Energy is Voltage.
It's a good one. Yeah, that is a good book. All right, Miss Larkin, Miss Jennifer, alkaline drip. What is in that drip? What is the energy drink you mentioned? Sulfonic. How do we protect ourselves before, during, and after a scan?
Yeah. So what's in the drip is a certain percentage of baking soda with minerals and vitamin C. The energy drink, well, it's not energy drink. I think you were talking about the device called Cellsonic.
Cellsonic, yeah.
So you can look up Cellsonic.
Mm-hmm.
And how you protect yourself from a scan, you would do a bath, baking soda, clay, and Epsom salts, along with a special supplement called SOD. SOD is superoxide dismutase, and that detoxes the radiation in the body.
C60 is good with that.
Yeah,
right?
also.
That's a good one. Yep. Take over to lower the D-dimer. Yeah, that's the Nepronol, right?
Yes, the Nepronol.
Nepronol's a good product. Finding out.
And then you want to make sure, I don't know if you're seeing, you want to take the D-dimer and then check that every couple of months to make sure that's going down.
I have high levels of Epstein-Barr.
Yeah, you can do a blood test to check for a titer.
Beamer, increased circulation. Does the increased circulation also help fuel the cancer?
No, that's a good question, but no, it is. The Beamer is very good for increasing the circulation, but the more you increase the circulation, the better oxygen, the better, detoxification, everything works better.
Let's see. Once we're at the clinic, since we don't know in advance what is needed, will it easy to schedule that required treatment without advanced booking? Some, but our scheduler does know which ones that Dr. Connealy really wants the patient to have early on in the process.
Right.
So, Carolyn, they will help you with that. If the need arises where we're looking at everything, I'll give you a quick. I like to use this example. We had a patient a few months ago fly in from Connecticut, and she was stage 4 ovarian, on chemo in Connecticut, but wasn't tolerating it well at all, so she stopped. So when she flew in here, it was, I'm going to fly in, I'm going to do the testing, I'm going to stay for a couple of days and then fly home. But what we were finding and seeing really wasn't a good idea for her to fly home. We really needed to get her started potentially on lower dose chemo. It was an aggressive form, and the doctors had told her all that. So instead of flying home, we decided kind of on the spot, on the fly, to keep her here and then to be aggressive with her initial treatments. Where some people, to your point, can fly in, we can see what's going on. If it's stage 0, stage 1, maybe have them do a little bit at home, wait for all the testing to come back, and then they fly in to do the care.
Right.
Well, so to your point, Carolyn, if we find something like that, we may say, hey, let's hunker down. Let's not go home because we don't want to just idly wait and do nothing. Right. So that there's some patients that come in, like I always use this example. They already had surgery. They already had radiation. They're not finding anything. They're here to prevent reoccurrence. Well, we may not have to be as aggressive initially with that patient.
Right.
Is that fair?
Yes.
So there's two paradoxes there that we just use our best judgment. So Carolyn, that might be, but if you had to stay, we can accommodate. Is that fair?
Yeah. And our staff is very accommodating, staying early, late, everything. So.
Yeah. All right. Chemo per my oncologist advice first, or seeing you first. Supposed to start next week, but I have a Zoom consult with you guys next week.
Oh, great. Okay.
Yeah.
Well, I have no problem with you. Starting. I don't have a problem, and then we'll tell you what to do so you can, handle chemo. You can lower your risk side effects profile, what to take for your immune system, how to protect your cells, all that kind of thing. So,
is there a wait for initial consult?
Sometimes.
Yeah. It depends. It depends. Right now, I'm not 100% sure, but I would say within a couple of weeks or so, or a few weeks, we could certainly get you in. Chronically low platelets, no cancer diagnosis.
Okay.
Yeah.
So you need to figure out why you have the low platelets. And then what we usually use for low platelets is sesame seed pearls and or beet powder or beet juice. So that's what I would do. But again, you got to understand why you have that. So
blood cancer. Friend, sorry to hear that, by the way, just died of blood cancer, had MS as well. How does one get blood cancer? Whereas I also have MS and have HPV flares. Well, like any,
disease process, you have to go on a discovery journey to figure out what is causing all of this. Is it, root canals? Is it viruses? There's a lot of viruses related to MS. Mm-hmm. What is your immune system doing? So we need to do a comprehensive and immune analysis. I call it the T lymphocyte map. And so then, so you have to any label, your goal is to unravel the label and not become the label. So
stage 2B triple negative breast cancer more aggressively compared to the hormone positive breast cancer.
Right. That's true.
Yeah. Yeah. You definitely would. The triple negatives, right, based on experience, based on what we know.
Right. She's already seen this.
Okay. In remission from rectal cancer, oncologist recommends COVID vaccine booster here in Hong Kong. What would be your thoughts? Second question, post-chemo DMS, white blood specialty neutrophils consistently low. What can I do? Okay. So the first one, as far as the COVID, right? The vaccine, the booster.
Right. So we don't know. I know I was talking to one of my oncologist referrals, and he was discussing with me that there may be something with dysregulation of T cells. So, when you're trying to recover from an illness, I don't like to, they don't even let you get a flu vaccine if you're sick. Mm-hmm. So I embrace the precautionary principle is like, let's get you completely well first before we start introducing things that are maybe challenging to your immune system.
Yeah.
So your white blood cells, are low. So you need immune enhancement. You may need thymosin peptide. So you need to take, some very specific targeted natural substances that, help your immune system. So you're in Hong Kong, we have patients in Hong Kong, we have patients in Singapore, all over, everywhere. So I would do a consult.
Yeah, for sure.
Because just because you're in remission, what does that mean? The scan shows no evidence of disease. Again, if your body is no evidence of disease, you need to do everything you can to stay not in remission, mm-hmm. but cancer-free, right?
Yeah.
And so I would make sure with all the proper blood testing and everything to, because I have a patient that she had stage 4 rectal cancer mets to her liver. She's like 6 or 7 years out. She lives in Florida. And I see her every 6 months. She's in remission. She's stage 4 to stage 0 now. And she sees me regularly and does all the things she needs to do. So it can be done, but you got to do all the proper, you got to go down the rabbit hole to see. So,
and to your point, remission, is that remission in the conventional world where they do the scans and they do everything and they're like, hey, it looks good?
Yeah.
Or does that include doing the circulating tumor testing?
All the blood tests, NAGLH, yes,
right.
All of that.
So there's the deeper dive that we like to go in and say, okay, if these are high or this is a problem, it could look in remission because, to your point, scans only show a certain amount. Right. But these deeper tests tell us, we still have the potential of these circulating tumor cells creating havoc.
Right.
So we still work.
Yeah. And your immune system is challenged because that's why you said, right. Your neutrophils are low and white cells in low and everything else. So do you want to answer more questions because I have a meeting?
Yeah, no worries.
So I appreciate every single one of you participating in Dr. Boney and our life journey today. I encourage all of you that self-care is the new healthcare. That's why we teach a lot of our patients how to take care of all of our patients how to take care of themselves. And we encourage you to take the power to yourself and take charge of your life. And we're not the only people that know things, but I would encourage you to read and listen to anything and everything. And we're here to partner with you in any way possible. So thank you very much.
Thanks, Doc. Yeah, I'll stay and wrap it up. Okay. I'll do a couple extra questions and then I'll just do a summary. So Thank you, dear. Thank you. All right, gang. So one thing I'd like to do with hearing the case studies and getting an idea of the different treatments and the approach, what I'd like to do is just kind of put it in a package. I usually start this way, but I think it's relevant that you hear it now because I think if you're new to this, it'll make a lot of sense. Your first, if we did a 4-pillar plan or just a plan in general, and if you've been on here, I like my plans. I think the outcomes are more predictable if you have a very good plan. So the first step in that plan is making sure you're doing the right testing, whether that is your scans and your lab tests that are generally in the conventional world, or we get a little bit deeper and we do things like the RGCC test, the Garden test. And what we're finding is, as an example, if I have a patient that had the lumpectomy, had radiation, is told they're clean and in remission or totally clear, and then their circulating tumor cells come back high, we still have work to do because those circulating tumor cells can turn into, I think Dr. Connealy said a high percentage can turn into another cancer or the same cancer. So we want to look at those numbers. We want to look at something called nagalase, which is an enzyme that is secreted by the cancer cell that if it is high, it's blocking our own immune system from attacking the cancer cell. Or PHI, which tells us that those cells are in an anaerobic environment, so we need oxygen therapy. The point I'll make is some of these lab tests that we could do here or in the integrative world is going to take a deeper dive into individualizing the care more, right? So we don't want to just take that one chapter of the 20 chapter book. We want to go deeper so we can add more chapters and more layers to increase your upside and mitigate your downside. All right. So that's pillar one. Pillar two, let's put this in context, is the kill phase. A big part of pillar two of our care is how do we kill those cancer cells? So we can do conventional, where it's chemo, surgery, radiation, or fractionated chemo, which is more of the low dose chemo. There's immunotherapies. There's different things within pillar two that can be done. How we recommend it is dependent on what's presented. If somebody presents, with an aggressive form, we may go this direction versus this direction. So all the data that's collected can give us an idea of what advice to give within that pillar two. If you had to do conventional, then I can tell you point blank that my eyes over the years being here tells me that we can add all these adjunctive therapies, oxygen therapy, immune boosting therapy, alkalizing therapy, metabolic therapies that clean up the causes and clean up the metabolic system in the cells to allow you to tolerate that much, much better, right? So if you had to go that direction and you did it only in the conventional world, you're not getting causes. They're not looking at causes. They're not boosting the immune system. They're not alkalizing. They're not oxygenating. So people can do poorly within the conventional model if that's the only tool in the toolbox, right? So as we talked about earlier, there's so many other things that can be done today to help help somebody if they're going through the conventional surgery, chemo, radiation, whatever it might be. So I want you to know that. I want you to know within that pillar two, if you had to go this direction, there's a lot of things that could be done. Many people come here because they don't even want to entertain the chemo thought. They'd rather, if they're going to entertain it, I should say, they're going to do lower dose chemo, which is, they call it fractionated chemo with a modulator, which means we bring down the blood sugar, we bring it into a therapeutic dose and infuse the chemo agents while the blood sugar is low, which allows the cell or causes the cell to almost become starved. So it sucks in the chemo agents and the surrounding cells are left intact. So we can use 10% of the 100% dose or 20%. We can use a fraction of the amount of chemo because it's more targeted. And then we can use the chemo agents from some of the testing as opposed to just doing cookie cutter. Hey, we'll pick this one and this one because these are what the studies have showed over the years. We don't want to do the cookie cutter approach. We'd rather take a more individual, specific approach to your body based on what the testing shows. So that's how we can individualize some of the care. Getting into pillar two, as far as the kill phase, that's how we can offset some of the negative effects if somebody had to do conventional chemo, surgery, or radiation. So I want to make sure that you understand that there's a lot that can be done if you had to go that route. And then, of course, the final pillar 4, is like eating an elephant. It's one bite at a time, which means we have to figure out, or we should, I'm not saying we have to, but we really should figure out what caused this fuel to the fire, right? Is it stress? Is it hormone imbalance? Is it, overwhelmed just with life and toxins and environmental stress and chemicals and heavy metals and infections and so forth? There has to be things going on in your body that cause the fuel to the fire that's creating free radical damage or free radicals that then is damaging your cells and the ability of the cell to go through cell death. Instead, the cells and the genomes are damaged where those cells are replicating out of control. But that starts with some fuel to the fire, right? Then there's inflammation, free radicals, damage to the cell, what they call oxidative stress, and then those cells replicate out of control. That's the lineage. So it has to come back to something or some things. So again, looking at those causes and peeling back the layers of the onion are critical to the process of healing long term. If, as you see with the first case, Erica, the ovarian case, or Aaron, who was on weeks ago, if you're doing that plan and you're doing it thoroughly and you're hitting it from every angle, you're increasing the predictability of the outcome, right? You're decreasing chance and you're increasing predictability. And to me, it's the best thing you could do for yourself, because also mentally, you know that you're doing everything you can and you're in a place and in an environment where they're thinking that way and facilitating that for you, which means you can just relax and heal, right? It's power. In a diagnosis in the conventional world where you are powerless, this is a way to get power. And power is by education and information. And when you have a plan that's well thought out and well detailed, you get that power and you have more control over this chronic disease than you would otherwise have. And I can't tell you, I think that's the most important thing you can do for yourself going through this. And that's why we do the classes. Okay. So hopefully that summarizes everything, ties it into a nice little package, and gives you an understanding of the 4 pillars and how they're applied and why they're applied after hearing some of these case studies as well. Okay. So any questions we didn't get to, everybody, we will get to. I promise you that I'll have Shep take them all down. We'll get the answers and then we'll email them out to you. Okay. So have a great couple of weeks. If you have any questions, concerns, let us know. Happy to help you in any way we can, and certainly wish you the best. Keep coming on. We'll keep educating. I think it's a mission now for us to basically just keep educating, whether it helps, the practice or the plan is really irrelevant, I say, meaning, the practice in this clinic itself, I always say it's a wonderful clinic, great doctors, wonderful doctors, wonderful modalities under one roof, probably the best in the world, quite honestly, based on even my personal experience. But I'm really biased to the plan. I think if you can follow a step-by-step plan, I think you're going to have a better chance of fighting this thing and more control over it. I just think the clinic is great because everything's under one roof and everything is guided. You don't have to think through and piecemeal it. And I just don't see the piecemealing work real well. That's the part, I guess there's a biasness to the clinic. But anyway, have a good couple weeks. If you need anything, just let us know and we'll see you in a few. Okay. Much love to you all. God bless. And we'll see you soon.